Hello everyone, Happy New Year. Welcome back to my YouTube channel. My name is Lena Tonyango. Last we discussed about lower backache, and today we are going to discuss about musculoskeletal disorders. It is going to be a brief discussion. Before I begin, I just want to advise you to subscribe to my YouTube channel, like the page, so that you can be getting each and every update that I post there. I usually post very informative information, and as I said last time, information is power. So if you are given freely, grab that opportunity and utilize it well. And in addition to that, if you are not affected, then your neighbor can be affected, your friend can be affected, any family member can be affected, even your enemy can be affected. So let's grab this information and then share it as wide as possible so that you can save a life. There's nothing that pleases God like if you save someone's life just by giving an information to that person. Maybe that person was in a position not to have this information, but you now have it at hand, so you can share it out as much as possible. Apart from on my YouTube channel, I usually give health talks across, and nowadays the digital world has made everything so easy. So it's not a must that I even come physically to where you are. At your workplace, various organizations usually have health talks. You can always contact me because I leave my contact behind. I can always do a Zoom meeting with you people and I share ideas with this. We do a discussion, you ask me questions, I give you responses, you give me your feedbacks and how you want me to improve at the same time. So all those things I can do. So because you have my contact behind, you can always contact me, share a lot, and save life. Because we want to talk about musculoskeletal system, I'll introduce it by saying we have my musculoskeletal disorders. I'll introduce it by saying that you move because of the musculoskeletal system. I walk because of the musculoskeletal system. My joint can be this flexible because of the musculoskeletal system. So you can imagine if we never had it, then how will life be without musculoskeletal system? So it's a very important topic. And when I talk of musculoskeletal system, what I mean is that it comprises of the bones, all the bones in our body, all the muscles in our body, the tendons that we have in our body, the ligaments that we have in our body, and what else can I say? Uh, we have the tendons, the ligaments, the muscles, the bones. Yeah, they are those. So when we now move to musculoskeletal disorder, is any condition that affects our bones, any condition that will affect the ligaments, any condition that will affect the muscles, any condition that will affect the tendons. So any condition that affects these, we term them as musculoskeletal conditions. Musculoskeletal condition is a leading cause of disability worldwide, and I talked about lower backache in our last discussion. Lower backache is a condition of musculoskeletal actually. So, and last time I also said that it is also a leading disability worldwide. So today I'm going to narrow down my discussion to arthritis because musculoskeletal system is a very broad topic. If we begin to discuss it, we can discuss it for years and years, even 10 years. So I'll just narrow it down to arthritis and discuss something small on arthritis. So when I say arthritis, it's a disease of the joint. That is how we usually call it, a disease of the joint, of the joints. When I say joint, we have this bone here and I have the bone here. Now whatever is causing this joint to be very flexible is what we call the cartilage. We have cartilage here that joins this joint and this joint. So where a bone is joined by another bone is called a joint, and in that joint we have whatever we call a cartilage. So that cartilage cushions every bone from this side and this side and makes flexibility of that joint possible. Because of some causes like a lot of exertion, trauma that might be there, sometimes, or age, uh, sometimes the cartilage began to uh, to to reduce in size. As a result of that reduction in size, the bones from this side and this side will be exposed to whatever we call wear and tear. Now, as a result of that wear and tear, then this bone and this bone can rub each other. When they rub each other, they can lead to a friction. And that friction is what will now lead to some symptoms, like a patient will tell you, hey, daktari, siku hizi nakuwa na joint pain, siku hizi niko na joint stiffness, siku hizi I have swellings of the joints. We have several types of arthritis, but I'll just mention few because we have over 100 types of arthritis. But I'll just mention the most common types of arthritis, like we have osteoarthritis. It is the most common type of arthritis that we have worldwide, and majorly occur on the joints as a result of a tear and wear that I've just mentioned. You'll find that the cartilage has reduced in size, leading to a lot of friction in that joint. As a result, presentation will still be the same: stiffness, joint pain, tenderness when you touch, joint swellings. So those are those are the symptoms that we usually experience. And management for osteoarthritis, or not before management, how we do the diagnosis is through history and examination of that patient. A patient will give you the history, and then you will be able to make the diagnosis. We can always send for whatever we call X-ray to check the cartilage. If we have arthritis, we will find that the cartilage is reduced in size, and sometimes if the X-ray cannot reveal to us a lot, we can go ahead and do whatever we call CT scan or MRI. At the management for osteoarthritis, majorly we use the analgesics, the corticosteroids, and sometimes you hear people say that they have gone for replacement of a particular joint. It can be a hip joint, it can be a knee joint, but that is if we have severe cases. Another type of arthritis that we have is rheumatoid arthritis. Now, for rheumatoid arthritis, this one is majorly not caused by the tear and wear. Now, in our body system, we have whatever we call the immune. We have our immune system. Now, this immunity helps to fight infections in our body. But again, sometimes our immune system can turn against us, against your own body. Now, in rheumatoid arthritis, it is an autoimmune disease. An autoimmune disease to mean that your own ascaris, your own protectors of the body will turn. Now, the immune system will turn to start fighting the whatever we call the synovial membrane. Synovial membrane is usually around the cartilage and the synovial fluid. So it protects and cautions that area from any friction. So it goes and cause tear and wear to that membrane, and as a result, we will have the same symptoms that I was talking of joint pains, the joint swellings, the joint stiffness. So in a rheumatoid arthritis, it is an autoimmune. Your own immune system starts to fight you and cause danger to your body. Um, Majorly, the predisposing factors are genetics and and uh, cigarette smoking. Actually, cigarette smoking is one of the number one cause of this, and alcohol consumption. So we should avoid those things. Sometimes lifestyle modification is very important when it comes to rheumatoid arthritis. And then another type of arthritis that we have is juvenile or gouty arthritis first. Gouty arthritis also is as a result of the type of foods that we consume. Gouty arthritis occurs when we have whatever we call the purine in our body. So these are chemicals that are being broken down, and they are being found richly in some of the foods that we consume. One of them is the red meat. So hiyo nyama choma, I'm going to take a roasted meat. So that nyama choma that you take a lot is not good for you, and it is not good for me at the same time. Actually, it contains a lot of uric acid. When these purines chemicals are broken down, they produce a lot of uric acid, and that uric acid is what is dangerous, and is when it is too much in the body, it leads to gouty arthritis. And another food is some of the seafoods that we take. Alcohol consumption is also another leading cause there of gouty arthritis. So we need this one we can modify our lifestyle. One of the most common symptom is on pain on the big toe. Actually, a patient will just walk in and tell you, Daktari, I have severe pain on my big toe, and that just began a few weeks ago. It can be pain, stiffness, and swelling, but majorly it starts from the big toe, but can spread to other joints. And then we also have septic arthritis, very common in children, but can also be found in adults. Septic arthritis occurs as a result of infection in our joints. So when we have infection in our joints, it can lead to septic arthritis. We'll present with the same symptoms. And another thing that I wanted to say on rheumatoid arthritis, it's not only affecting the joints. That is what makes it different from other arthritis. It doesn't affect only the joints. This one can affect now the skin, can affect your eyes, can affect your heart, can affect your lungs. Actually, it's a very bad kind of arthritis, because someone can just come in with the symptoms of difficulty in breathing or even coughing, and then you make a different diagnosis. Yet we are having rheumatoid arthritis. Another type of arthritis is juvenile arthritis. We call it juvenile idiopathic arthritis, very common in children. Actually, children from just from birth up to around 16 years. So 16 years and below can as well experience this kind of arthritis. Presentation will always be the same: joint pains, joint stiffness, swellings. Now, patient has come to you and you want to make a diagnosis of this kind of condition. So how do I make this diagnosis? From history and examination of the patient, the joint pains, the stiffness, the swellings, and then after that, I will also send for some lab works. Like if I have rheumatoid arthritis, I will send for what we call the rheumatoid factor in the lab to check the level. If I have something like gouty arthritis, I will need to check the uric acid levels in the lab. And then I'll go further maybe and do something like x-ray of that joint to see if I have any degenerative nature on that joint. If at all the x-ray is not revealing for me what I need for proper treatment of the patient, then I will go and send for either CT scan or MRI. They somehow will give you almost the same result, but MRI is a bit comprehensive as compared to CT scan. And then from there, maybe you've done this and you've come up with your diagnosis. Now you go ahead and do the management for this patient, where you will advise on generally one of the risk factors of arthritis is being obese. I talked of obesity last time, and I gave you an assignment to just walk into any facility, uh, check your BMI. uh, BMI, I told you how you calculate it. Just a recap on how you calculate it. I told you, walk into the facility, tell them that you want to know your weight, tell them that you want to know your height, divide that weight by your height squared in meters, and then get your BMI. I also gave you the ranges. Check on our last discussion or on our last video, and you will see the ranges for the BMI, and uh, grade yourself. Are you underweight? Are you within the normal weight, or are you overweight or obese? So people who are overweight and obese are more predisposed to arthritis because of the exertion of pressure that is being caused on the on the joints. And some of the joints that experience a lot of exertion of pressure from weight are the knee joints and the hip joints. So to avoid that, we must work very hard on our diet. If it is something like I've mentioned for rheumatoid arthritis, not for rheumatoid arthritis, actually in that case we may not have much to do because it is your own immunity. So that one is for the doctors to see on how to assist you and protect your immune from fighting you. There are some medications that you will always be given for something like gouty arthritis. So you mean you cannot stop taking the seafoods or the red meat. So you can stop. That is your body, your life. You can modify it as much as you can. And when I say stopping, it doesn't mean that uache kabisa. You can take it, but in a minimal amount, and you make sure that it is well cooked. And things like alcohol consumption, I've also said that they also contribute to arthritis. These are things that we can modify and stop. So today I didn't have much to share with you. I have that little discussion with you. Next week I'll be talking about cervical cancer. I'll talk about cervical cancer because we are in the month of cervical awareness, and this is a very crucial topic, as I mentioned it. Make sure you subscribe. Make sure you follow. I'll post that video there. It will be of very benefit to you, benefit to your neighbor, benefit to your friend, benefit to anyone that you are associating with. We are in media, you can always share. So cervical cancer is a very crucial condition. I'll give you much information on that, and I say let's all take care of each other, and let's remain blessed as we look forward to a very informative discussion